US President Donald Trump is now targeting imported generic medicines with a new tariff plan, and the proposal could have major implications for the global pharmaceutical industry, especially India. The US President has announced a 100% tariff on imported generic medicines from August 2028. Until then, these imports will continue to face zero tariffs. Then, from August 2029, the tariff will double to 200%. The phased rollout gives pharmaceutical companies 2 years to move manufacturing to the US before the tariffs come into force. The announcement is part of Trump's broader push to bring pharmaceutical manufacturing back to the US and reduce dependence on overseas supply chains. Trump said the policy is meant to reshore generic pharmaceutical production into America. He also said his policy on patented and branded medicines remains unchanged. Trump has repeatedly said that Americans pay higher for medicines compared with many other countries. He believes bringing pharmaceutical manufacturing back to the US can help make medicines more affordable. This isn't the first time Trump has targeted pharmaceutical imports. In April, his administration announced tariffs on branded pharmaceutical imports. Companies could avoid those tariffs by accepting government-backed pricing arrangements or shifting manufacturing to the US. This time, the focus is on generic medicines, while Trump's policy on patented drugs remains unchanged. Generic medicines are cost-effective alternatives to branded drugs. Most generic drug makers operate on thin profit margins and depend on global manufacturing networks. That's why absorbing a 100% or 200% tariff isn't easy for them. Instead, they may have to increase prices, reduce exports, or shift manufacturing to the US. India is expected to be among the countries most affected, as it is the biggest exporter of generic medicines to the US. In 2024 to 2025, India exported pharmaceutical products worth $10.5 billion to the US, making the sector one of its top 3 exports to the country. Indian companies supply a wide range of medicines to the US, including treatments for diabetes, high blood pressure, cancer, infections, and mental health conditions. In fact, Indian generic medicines account for nearly 40% of prescriptions by volume in the US. The immediate impact is likely to be limited because companies have a 2-year window before the tariffs take effect. However, Bloomberg estimates that duties on drugs could adversely affect more than 40% of India's exports to the US. At the same time, a trade pact signed by India and the US in February provides for negotiated outcomes on generic pharmaceuticals. So it's still unclear how much of the proposed tariffs Indian companies will ultimately face. But Indian drug makers will have to eventually prepare and rethink their manufacturing strategy. Follow Business Standard for more such stories.